So, my friends, today we will be talking about interpreting chronological age, born age, and height age in a child who has got short stature. So, let's start. Now, short stature workup requires a thorough history with a thorough examination. You have to do, you have to calculate anthropometric indices, including weight for age, height for age, weight for height, and all these types of anthropometric workup. You also need to calculate the parental height, and you also need to do a few tests again, which would be dictated by the history, by your physical examinations, and by the other circumstances. But it's also important at the same time that you have got a very clear cut understanding of number one, chronological age, number two, born age, number three, height age. So let's discuss these terms so you have got a very clear understanding, because if you understand what is chronological age, what is born age, and what is height age, then you can actually compare these three to understand what could be the underlying differentials in a case of a child who's got short stature. So the first thing is what we call as chronological age. Now, chronological age means age of the child according to the date of birth. So let's say if a child was born on 1st of January 2020, as of today, his age would be almost 3 years. So any child who has got unknown date of birth, it's very easy to calculate their chronological age. So a child who is 5 years of age has got a chronological age of 5 years. A child who's got 10 years of age, he has got a chronological age of 10 years. So that is chronological age. The next term is bone age. So what is bone age? Bone age is basically the degree of skeletal maturity of the bones. Bones of the child, they get mature in stages. So at certain stages, different types of ossification centers they appear. So based on the appearance of those ossification centers, you can determine the bone age of the child. Now that requires that you do the x-rays. Now depending on the age, x-rays of different parts of the bodies can be used. But by and large, in a child who usually has got short stature, because usually short stature comes into limelight when a child is somewhere around like 10 or 12 years of age, because usually nobody gets bothered about a child who is like 1 or 2 years of age, because at that point in time they are growing. So short stature is very rarely picked up in that age. It's usually like around somewhere between 10 to 12 years of age that the parents would get worried about the height of the child. So at that age, usually the X-ray that we use is the X-ray of the left hand and the left wrist. So X-ray of the left hand and the left wrist is done, and in that we look at the ossification centers and we compare these X-rays with standard charts. So there are standard charts which are published. These are charts for for X-rays of the hand and the wrist, and then the X-ray of this child is compared with those charts, and after comparing, you can determine the bone age of the child. So bone age of the child is determined by what? By X-rays. Third thing is the height age of the child. Now, what is the height age of the child? Every child has got some height. For example, a child might have a height of 120 centimeters, another child might have a height of 130 centimeters. So the first thing is that you have to calculate the child's actual height. Now, the child's actual height is his actual height. That is not the height age. Remember, some people think that the height age is basically the height of the child. No, 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 not at all. The actual height of the child is what we call as the actual height. Okay. Now, the age at which this height that you have determined, that child, that would normally be achieved in a normal child, that would be the height age. Are you confused? Okay, let me clarify this thing. Let's say a child who is 7 years of age, okay, and you calculate his height on a stadiometer, and that height comes to be around, let's say, 100 centimeters. So 100 centimeter, let's say I said this child is 7 years old, and his actual height, which you have measured, is 100 centimeter. So this 100 centimeter is his actual height. This is not the height, this is actual height. Now, the question is, at what age, if a child is normal, at what age would he actually attain 100 centimeters in his height? So if you look at the standard charts, a child who is around 4 years of age, he would attain the height of 100 centimeters. So a normal child would attain this height, that is 100 centimeters, which we have calculated as an actual height of the 7-year-old. He would attain it as 4 years of age. So the 4 years is basically the height age of this child who himself is 7 years old. So at 7 years, 100 centimeters is his actual height. But if you compare, a normal child would attain this height at 4 years. So 4 year is would be his bone age. So height age. So his height age would be what? 4 years. So actually his chronological age is 7 years, but his height age is 4 years. Why? Because his height, that is his actually current height, that a normal child would achieve at 4 years of age. Now, how we basically do this is that if we take a growth chart. So for example, here we have got two growth charts. These are for 2 to 20 years old, and on the left side we have got the height charts for the boys, and on the right side we have got the height charts for the girl. So let's say is a girl who is 10 years of age. So let's say this is 10 years. So if you see the 10-year marker is here, and at 10 years of age, this girl, let's say, has got a height of 120 centimeters. So her age is what? 10 years. And you have calculated her actual height is 120 centimeters. So let's mark where it stands on the height chart. So we look at this is the 10-year mark, and we would follow it up where it intersects the 120 centimeter mark. So the 120 centimeter mark is here. So you can see this is the actual height of the child. Now, what is the height age? We would follow it till it crosses the 50th centile for a normal line. So if we just follow a line from this side, okay, and where it crosses the 50th centile, so here is a mark where it crosses the 50th centile. It touches the 50th centile. We would look the age under that. So if we draw a line, if we look age under that, that is 7 years. So this girl who is 10 years old and has got a height of 120 centimeter, her height age is what? 7 years. So this is how we calculate the height age on a height chart. So chronological age, again, I told you that is according to the date of birth. Bone age is according to the x-rays of the left hand and wrist, or maybe other areas depending on the age. And the height age is basically calculated from the height chart. So you need to have the actual height, you plot it on a height chart, and then you draw a horizontal line from that actual height to a point where it crosses the 50th centile for that height, and you would draw a line beneath that, a perpendicular line, and that would tell you the height age for that particular child. For example, in this girl who was 10 years old and had a height of 120 centimeter, the height age is 7 years. So that is how we calculate the height age. So after it has been clarified that how you calculate the chronological age, how you calculate the bone age, and how you calculate the height age, let's move forward and how do we interpret these three terms. Now remember, in a normal child, a child who has got normal stature, your chronological age would be equal to bone age, which would be equal to height age. There might be a little bit of difference, like up to 6 months of difference. If you find it, that is absolutely normal. Okay, so by and large, in most of the cases, if the chronological age is near to the bone age, which is near to the height age, that is absolutely a normal stature child. So there is no problem over here. But if there is a discrepancy where the chronological age is not equal to the bone age or is not equal to the height age, and you see there are more than 6 month differences between any of these two of these three items, then there is a problem. And usually these problems help us in identifying the further differentials of a short stature. So I will discuss it now. So what happens, first of all, like for example, if you have taken the chronological age, you have to done the bone age, you have done the height age. Now see, you've got now three sort of figures with you. See which one is the highest. Which one is the highest? Is it the chronological age, which is the highest figure? Is it the bone age, which is the highest figure? Or is it the height age, which is the highest figure? Like, for example, if a girl has got a chronological age of 7 years, bone age is also 7 years, height age is also 7 years, that's normal. But somebody whose chronological age is 7 years, bone age is 5 years, and height age is also, say, let's 5 years. Now, there's a discrepancy. So we see here which one is the highest. Here, the chronological age is highest. Okay. But let's say if you find that the bone age is the highest value of all the three. If the bone age is highest of all the three, then it simply means that the bones have matured early. It simply means that the bones have fused very early, and because they've fused early, there is no potential in them to grow further. That's why the child is of short stature. And this usually happens where there is precocious puberty. So precocious puberty could be because of various reasons. It could be because of congenital adrenal hyperplasia. It could be because of endogenous or exogenous excess of sex hormones, androgens, so on and so forth. I don't have time to go into all the differentials of that, but by and large, if it is associated with precocious puberty, you will see that the bone age is highest as compared to chronological age and height age. So that usually is the condition. It's usually associated with precocious puberty, and you will see then again there is a whole list of differentials under this umbrella. So basically, if the bone age is highest, it simply means it is associated with excess of the sex hormones. Okay. If chronological age is the highest value of all these three things that you have measured, then there are further possibilities, and we would discuss. Let's say if your chronological age is equal to bone age, chronological age is equal to bone age, but the height age is lower, then what you are dealing is with familial short stature. Familial short stature. These are those people who have got a family history of short statures. Most of the people in their family are of low heights. And because of low heights, similarly, the offsprings are also of low height. So that's why their chronological age is equal to bone age. It simply means that the bone age is equal to chronological age. Simply the bones are according to their chronological age. But the height is low. Why the height is low? Because there are genetics responsible for that. It's simply because they've got the genes in their family which actually keep them short. So, but that's why we call it familial short stature. These are the people who have got a family history of low heights, and maybe there are cousin marriages and so much going on. That's why the offsprings are usually, majority of them would be of low height. So that is familial short stature. So in familial short stature, your chronological age is equal to bone age, but the height age is lower. Like, for example, a girl who is 9 years of age and the bone age is also 9 years of age, but the height age is, let's say, of 6 years old. So that is familial short stature, and further digging into the history can further clarify this thing. If the chronological age is greater than the bone age, let's say chronological age is 9 years and bone age is 7 years, but the height age is equal to the bone age, it simply means that this child is trailing a bit behind. So it simply means that the bone age and the height age, they are, sort of corresponding to one another, but the chronological age is slightly more. So they are actually what we call as a late bloomer. So that the term that is used for that is constitutional delay of growth and puberty. Most of the kids, they fall in this age group, this diagnostic group, and there's nothing to worry about because they usually catch up in their final heights. But the only thing is that late bloomers. So if you go further into their histories, you will probably find out that their parents were also late bloomers, and they probably picked up on their heights in the end of adolescent age group. So here, how do you know that? Obviously, there are no sort of external markers of organic pathology. These kids are simply a little bit on short on the height, but I told you that the bone age and the height age are equal to one another, but slightly trailing behind the chronological age. So if the chronological age is greater than the born age but equal to the height age, you are dealing with a constitutional delay of growth and puberty. The third thing is where the chronological age is greater than the born age and the born age is greater than the height age. In other words, the height age is the lowest. So a child who is 10 years of age, born age is let's say 8 years, but the height is very small. That child has got height age of let's say 6 years. This usually happens in syndromic things like if a child has got Turner syndrome, okay, especially if the girl has got Turner syndrome XO. So these because there is a gene SHOX gene which like actually is responsible for the height. So one X chromosome is missing. This is 45 XO in Turner syndrome. That's why they've got short stature. Similarly, children with Down syndrome they've got short stature. So in these syndromes, the chronological age is the highest, then the born age is less than the chronological age, and the height age is the lowest. So chronological age greater than born age, which in turn is greater than the height age, and height age is the lowest. You're probably dealing with Turner syndrome or with Down syndrome. In many types of endocrinopathies, where there is problem with the endocrine glands like hypothyroidism, hypopituitarism, lack of growth hormone because of let's say some tumor in the let's say in the glands, the pineal gland, or maybe the pituitary gland, like craniopharyngium or things like that. If that leads to problem with growth, usually what you will see that the chronological age is greater than the height age, which is greater than the born age. So here, if you see, the order is slightly reversed. So the lowest value would be the born age. So if the lowest value is the born age, you are probably dealing with endocrinopathies. If the lowest value is height age, especially when one other, you're probably dealing with what? With syndromes like Turner syndrome or Down syndrome or Prader-Willi syndrome or Seckel syndrome, or there are so many like syndromes which can actually turn up with short stature. So if the chronological age is greater than the height age, which is in turn greater than the born age, what happens? Born age is the lowest value of all the three. You are basically dealing either with high growth hormone deficiency either because of a tumor or because of the receptor deficiency in growth hormone Larin syndrome, or you are dealing with other endocrinopathies like hypothyroidism, so on and so forth. One thing which is also very important is the prognostication or the prognostic values of the born age and the height age. Remember, where the born age is greater than the height age, where the born age is greater than the height age, the ultimate height will be less. Why? Because height is the lowest here. So there is very little potential because the bone age is more than that. So obviously when the bone age is more, now there is less sort of a potential left in the bones to grow further. So the ultimate height would be less. Like for example, in Turner syndrome or Down syndrome, if you don't treat them with the appropriate hormones, most of the time, ultimate height will be less. But where the height age is greater than the bone age, like for example, in hypothyroidism or in growth hormone deficiency, the ultimate height would still be better. Why? Because the bone age is low and still has got a bit of potential if you do the appropriate intervention. It's not like if you don't do the appropriate intervention, still, the ultimate height would be better. No, you have to do the intervention. But if you do the intervention, then possibly the final height would be better as compared to the conditions in which the bone age is more than the height age. So for prognostication factors, it is very important which is greater than what. Is it the bone age which is greater than the height age, or is it the height age which is greater than the bone age? So remember, bone age, if it is more, less potential for further growth, so the ultimate height would be less. Bone age low means it has got still further potential to grow if an appropriate intervention is done, and therefore the final height, if an intervention is done, would be better. So that way you can explain it to the parents as well as what would be the final height, or what would be the probability of where would this final height lie. Would there are more chances, even because sometimes even with the treatment you may not get very good results. So that's why you need to tell them what will be the probability of better outcomes with interventions. So for that reason, it's important you know which one is greater than what. So this was a small lecture about interpretation of chronological age, born age, and height age. It's very important. I will make another video on the what you call how do we um, assess a case of short stature. But to assess a case of short stature, it's also very important that you understand these values, because if you don't understand these values, you'll probably not be able to completely look into the differentials of the case. So I hope you've liked this video, and if you've liked, given me a thumbs up, and if you haven't subscribed to my channel, please do subscribe. If you've got any questions or comments, you can put it down in the comment section below, and I'll be more than happy to help you out in your queries. Have a very good day. Take care, and bye bye.